Can PET scans find colorectal cancer spread? Have you ever wondered how doctors determine if colorectal cancer has spread? One of the most effective tools they use is a positron emission tomography scan, commonly known as a PET scan. This imaging technique is particularly good at detecting cancer spread or metastasis beyond the colon. So, how does a PET scan work? It uses a radioactive sugar tracer, typically fluorodeoxyglucose, which cancer cells absorb more than normal cells. This allows doctors to visualize areas where cancer may have spread. Research shows that PET scans have a sensitivity rate of about 90 to 95% and a specificity rate of around 85 to 97% for detecting metastatic colorectal cancer. This means they can accurately identify cancer spread in most cases, often outperforming traditional computed tomography scans. For instance, in clinical studies, PET scans have identified approximately 93% of metastatic sites, while CT scans only detected about 46%. This highlights how valuable PET scans can be in assessing the extent of the disease. One of the key advantages of PET scans is their ability to detect liver metastases, which are common in colorectal cancer. Some studies indicate that PET scans can achieve nearly 100% sensitivity and specificity for identifying liver metastases. They are also effective in spotting lymph node involvement and local recurrences, which is crucial for treatment planning. Another important aspect is that PET scans can differentiate between cancer recurrence and benign changes, such as scar tissue from previous treatments. This distinction can prevent unnecessary surgeries or treatments, which is a significant benefit for patients. However, PET scans do have limitations. They may not be as effective for very small lesions, low-grade tumors, or certain types of cancer that do not absorb the radioactive tracer well. Additionally, inflammatory or infectious processes can sometimes lead to false positives, as these conditions can also show increased metabolic activity. In clinical practice, PET scans play a vital role in both the initial staging of colorectal cancer and in monitoring for recurrence after treatment. They provide functional imaging that complements the anatomical details obtained from CT or magnetic resonance imaging scans. In summary, PET scans are a powerful tool for detecting the spread of colorectal cancer, especially in the liver and lymph nodes. While they are not perfect, their high sensitivity and specificity make them an essential part of the diagnostic and staging process in managing colon health and colon cancer. If you have questions about whether a PET scan is right for you, it is important to discuss this with your healthcare provider. They can provide personalized advice based on your specific situation.